So what is menopause? There is no definition, but the general consensus is that it is the final or the last straw or the last period. As I've said before, it's a natural process, and some women, they can go through the natural process, but there are a few other women who may have had surgeries earlier on in their life for other medical reasons, where they have their ovaries removed, and they have, or what we call a induced or surgical menopause. Menopause can also occur if someone has had chemotherapy or some form of stressor where it stops the functioning of the ovary. As I've said before, there is no definitive test to test for someone who is perimenopausal or menopausal. But one thing we know for sure is that we use symptoms as a guide. And often we have women come into clinic to ask about, is there any blood test, or do we use saliva or anything of that nature to tell that I have menopause or not? And our general advice is there's no right or wrong answer. We base it on your symptoms. But once you've had no periods for 12 months, 1 year out, is when you hit your postmenopausal phase. And this is an important clear distinction because the treatment for us varies on how we get the definitions. Now, when does menopause occur? Most women here in Australia, the average age at which menopause occurs is 51, but it can range, as I've said, between 6 to 9 years. Some have it earlier at 45, and some can have it at 55. If women hit menopause, meaning no periods at all, and they have the other symptoms of menopause at less than 40, then that is classified as abnormal, and it needs to be investigated further. And for those women who are under 40 and have symptoms of menopause, which we will talk about later, you need to seek medical help. You need to go and see a local doctor near you. So what are some of the menopausal symptoms? They can range. The menopausal symptoms that we most commonly women present with is hot flushes. And we call this in medical terms vasomotor symptoms. And some of these hot flushes can be very debilitating. If they are unable to cope with everyday hot flushes, sometimes dryness in the vagina, migraines, aches and pains, sleep disturbances, mood disturbances. They have problems with their bladder. They retain weight. They sometimes can experience crawling or itchy skin. And often always with the associated mood swings, these women can have irritability and just less focus, less concentration, and what we call less anhedonia or less interest in sex, or their libido level goes down. And these are some of the physiological processes that occurs behind someone who is undergoing the process of menopause.